Welcome again, everyone. And I think we will have a lot of people trickling in. Hopefully they will continue to try to get onto the webinar. But thank you all for joining our June Tobacco Free Tuesdays webinar. We have our entire tobacco control team here. I'm Gina Roberts. I'm the regional coordinator for the Southwest region. And also the acting program manager currently. We have Tiffany Eustace, she's from the Northwest region out of Blue Ridge Health District. Carrie Cannon from the North region out of Fairfax Health District. We have Sarah Burkhead from the Central region out of the Richmond Health District, and Nicole Mann from the Portsmouth Health District covering the Eastern region. So this is your tobacco control team. We're glad that you're here with us today. I think everybody heard me before, and if you're just joining, you know, slip in your favorite ice cream flavor. This is for those of you who hopefully remember the first day of summer. So if you were up at 5:15, I think, or 5:14 this morning when it officially started, you were getting a good start. This is actually also the longest day of the year. So we do have a long day ahead of us, which is good. So, but again, welcome to everyone to our Tobacco Free Tuesday webinar. We are going to start the webinar with our What's the Tea question, as we always do. So I would like Carrie, if you could put up our What's the Tea question. And this is just so we kind of know what you already know or what you may know about our topic as we do this. And our topic, of course, is you know, the proposed menthol ban with FDA, and Michael Scott, who is here from the Center for Black Health and Equity, will be talking about that proposed ban with menthol. So
I did launch it. So hopefully you can see it. Otherwise, we just must be having some Zoom issues.
We cannot, but that's okay. That is totally fine. We are good. You know, as we begin summer, it's relaxation, so we're not gonna stress. But the question was, I will read the question, and I know Michael will talk about this. Why is menthol so popular? And we had a list of 5 choices that you could choose and select. One is it masks the harshness by creating a cooling effect. And this is true, it does. It cools the mouth and the throat and makes it easier to go down. The second choice was it is a healthier option. And that is no, not true. Although you think it is, because menthol, we think of, you know, calming, stress-free, just a healthier option. C was it can alter the brain receptors' response to nicotine, and this is true. It enhances some of the effects of nicotine and makes it an even more addictive product. It suppresses coughing, and that is true. And big tobacco has effective marketing strategies for menthol. So that is also true. So that was our What's the Tea question. And there you go, Nicole, you're good. Nicole put it in the chat as I was talking, so thank you. So hopefully you were aware of those options. And Michael, again, we'll talk about this. So Michael, welcome to our Tobacco Free Tuesday webinar. We had Michael, as I mentioned earlier, on our last July webinar, one of our very first webinars, and he was wonderful. And so we reached back out to Michael after the FDA proposed the rules of banning and prohibiting menthol cigarettes and flavored cigars, and we wanted him to really go through that discussion with us and talk about what we will expect in the next few months with that. I know FDA has recently extended the comment period. I believe it was going to end July 5th, but now they've extended it for until August the 2nd. And Michael will talk about this as well. So we have some time to really make that comment on those, and how can we be impactful, and how can we do this? And that's a question to Michael as he starts his presentation. But Michael Scott was hired at the Center for Black Health and Equity in October of 2015. He currently serves as a senior program manager overseeing tobacco and cancer prevention and education programming. He has 20 years of public health experience on the national, state, and local levels. His work has focused on disease prevention in the areas of HIV, diabetes, cancer, and tobacco use prevention. And prior to his position at the center, he served as health education specialist at both the Durham County Department of Public Health and Duke University Medical Center. Welcome, Michael. We're so glad you're here, and I am going to turn it over to you.
All right, thank you. And I'm going to attempt to share my screen. And slideshow. Okay, can folks see it?
Yes, we can see it. Thank you, Michael.
Right. Perfect. Thank you. Thank you all for having me again. I think this is a very important topic, especially given the commenting period that is extended. So it was supposed to end on the July 5th, but there has been a 30-day extension. So that's awesome, because that's going to give more folks more time to submit their comments of support. But so today what I want to do is just talk a little bit about what the rule really proposes and what it doesn't propose, what it's kind of left out, and how when folks are submitting their comments, how they can address that to hopefully, convince the FDA to, make some adjustments and make it a little more comprehensive. And what I want to do, first of all, just give a brief history of how we finally got here. So again, we're on the verge of accomplishing something that we've been talking about for years and years, and that's getting menthol banned, menthol and other flavored tobaccos banned from sale. And we can go back to 2009. Now, the fight to get menthol and other flavors off the market started way before this, way before 2009. But the first time we saw some real action was that Family Smoking Prevention and Tobacco Control Act back in 2009 that took all flavored cigarettes off the market, but left menthol, exempted menthol. And that word exemption, that's the word that we're always going to be looking out for. Whenever we're talking about tobacco policy, the word exempt lets us know right off the bat, this is not going to be equitable. It's not going to be comprehensive. And we'll talk a little bit more about that when we get to these rules that we're talking about. Okay, so Family Smoking Prevention Act in 2009, 2011, because of all the pushback from organizations such as my organization, AATCLC, y'all folks like you all that are working in tobacco prevention programs, health departments, what about menthol? So the FDA was kind of forced to do some research and really look into the topic, which they did in 2011. 2013, now they've been looking at it for 2 years now. Nothing's been done. A lawsuit was filed to really, or not the lawsuit yet, but the citizens petition was filed with the FDA to say, we know that menthol is bad. You all need to do something about it. That's your job, is to protect the public's health. 2013, still no action later on in that year. However, we start to see some policy stuff going on. 2009, they took all flavors out of cigarettes. 2013, Chicago became the first city to do an actual menthol ban, all flavors. It was limited to where it was enforced, had to be within retailers that were within 500 feet of schools. But it set the precedent that we can do something on the local level. We can prevent menthol from being sold to populations who are already under, all these pressures and all this other negative health equity that a lot of times smoking contributes to anyways. And then this is where the lawsuit comes in. So it's been a few years now. There's been no action. AATCLC, Action for Smoking on Health, the National Medical Association eventually tapped onto the lawsuit, and they filed a lawsuit against the FDA for its non-action, for refusing to protect the citizens of the United States. 2013, 2021. So here we are 8 years later, the FDA finally announces that it's going to begin the rulemaking. It's going to do something. It's going to begin the rulemaking process, and that was April 2021. This past April 2022, they finally said, yes, we're going to do something. Here's what it is, and they released the 2 rules. So some folks are thinking, no, just the menthol rule. There's actually 2 rules, and I'll describe both of those in either the next slide or the slide coming up. So just to give it a little more time frame reference, 2009 to 2022. So over a decade it took to finally get the FDA to put some movement on this, do something real. Better late than never. But when we talk about health equity, there's some things that we can look at and see where, there was very quick, decisive action taken on flavors, not including menthol. But when it came to menthol being the flavor that impacts more people, more minorities, more folks who are already suffering from health inequities, it took them over a decade to finally do something. So here we are. They're finally going to do something. What's next? They want to hear from you, from us, from everyone regarding the public's opinion on these restrictions, these menthol bans, the flavored cigar rule. And this is just a screenshot of our website, and we're going to talk a little bit about where folks can go and how to submit their comments. And this is what the FDA site looks like. So I said there's 2 rules. So the first rule is that the proposed rule is to ban menthol as a characterizing flavor in cigarettes. So adding to the list of already prohibited cigarette flavors. Now, when we talk about banning menthol, the key word here is characterizing flavor. And I think that was one of the questions. So it's not banning menthol in its entirety. It's only banning menthol as a characterizing flavor in cigarettes. And one of the things we know is that pretty much all tobacco products, cigarettes, cigars, chewing tobacco, of course, menthol and mint are really some of the only flavors left in e-cigarettes, with some exceptions with how it's made and how it's sold, but that's a whole other story. So it does not ban menthol altogether, only as a characterizing flavor. And at what level does menthol become a characterizing flavor? Is it at 0.23%? Is it at 10%? I don't know. No one knows. There has not been an official statement from the FDA saying menthol at X amount, it means it's a characterizing flavor. So they have not defined what the content of menthol is that makes it a characterizing flavor. So that's one of the things that we'll, when we're making comments, that we want to question folks about. Now, the second part of the rule is that it will ban all characterizing flavors in cigars. And when we talk about cigars, we're talking about the Black and Milds, the cigarillos. So we're talking about a lot of these products that, again, are being used primarily by youth, primarily by African-American and brown communities, lower income communities, products that need to be gone to really impact health equity and make these restrictions and these bans as equitable as they should be. So what's not included in the menthol ban and the flavor ban? Electronic products are not included. So kids, youth, whoever can still get their hands on the mint and menthol, electronic products. Premium cigars are exempted from the flavored cigar rule, and these new heat not burn products are exempted. So these are the products that they still have tobacco leaf, but they don't burn the leaf. They just heat the leaf. So, you know how big tobacco is. They're going to find each and every loophole that they can to make sure that their product still gets out there. Now, for the commenting piece, and we'll get to the where and the how in a couple slides down. But when we're commenting, we want to be a little more comprehensive, and not just say, yes, we support it. We want to support it, and we want to suggest, hey, here's some things that would make it even better. Here's some things that will protect even more United States citizens, And we also have to keep in mind that removing menthol is not just impacting, minority communities, these priority populations. It's going to impact everyone. It's going to impact the public's health. Going back to that TPSAC report, the final message in that report was the removal of menthol will benefit the public's health. That's everybody. And we talk about, I think the one of the strongest, loudest voices has been, the voice of the Center for Black Health and Equity on how it impacts African-American communities, which it does more so than many other communities. But the bottom line is, 30% of the tobacco market, of the cigarette market, is menthol flavored cigarettes. And if the whole idea, the whole end game is to reduce initiation, is to assist in cessation, removing menthol is going to help millions of people, Black, white, brown, Asian, LGBT. It's going to help everybody. But back to the rule. Now, when the rule is finally announced, the FDA has said we have up until a year for retailers to actually implement it. What we want to say is, no, we need to do that quicker. Y'all need to do that in 90 days. Don't drag it out. Don't give big tobacco more time to research and file more lawsuits, more blocking points that could make it take longer. Once it's announced, 90 days, boom, it's implemented. And there should be no exceptions. There should be no exceptions for the heat not burn cigarettes, no exceptions for premium cigars. And one of the biggest points is no manufacturing of menthol at all. The way the rule stands now, there will be no selling, no distributing of menthol in the United States. Menthol products, menthol cigarettes will still be manufactured in the United States for import or for export. Now, when you think about it, I mean, wow. So we've decided that, this product is not good for the citizens of our country. We're going to take it off the shelves. We're not going to sell it. However, we're still going to make it, and we're going to put it out to the rest of the world. That's not ethical, first of all. So again, we want menthol gone, period. Gone as a characterizing flavor, gone from production. And, if there is going to be that characterizing flavor piece left, we need a clear definition of what that level is. What makes a cigarette, a menthol cigarette, as a characterizing flavor? How much menthol? There needs to be a clear definition that is broadcast and so people know exactly what it is. And one of the biggest things is there needs to be cessation at the local level, the state level, some cessation work really beefed up in the meantime. So while they're working all this out, the cessation needs to be available when this rule finally hits. And we know that a lot of folks, are going to quit, are going to try to quit if they can't smoke menthol cigarettes. So making that those cessation efforts as easily accessible, affordable, making it known where to go, how to use these products is imperative. And there has to be research around the community level, the cultural level. How are we going to get these cessation products into these communities? And again, making it accessible, and that may mean coordinating with social services, coordinating with insurance companies. I know a lot of insurance companies do cover cessation, but just making sure that, the system is ready for this influx of folks requesting cessation services. So at the local level, at the state level, even if, the FDA isn't doing anything on a national level, we can start doing that on the local level, at the local health department, at the state health departments, federally qualified health centers, whatever health center is in the community, getting those resources and making them available. Some other honorable mention points when you're making your comments. We need to think about, a lot of people are going to quit. Some folks may want to switch to the e-cigarettes, to the hookah, which is another exemption. So again, if we can make all flavors, all products part of this rule, that would be, what we would like to see. Things also to consider are the historical and racial justice context of this. So again, we see in African-American communities and in lower income communities, how big tobacco has really targeted and predatory marketing put those products, these menthol flavored products, these flavored cigar products in our communities. So just as strongly as big tobacco has placed them in these communities, there needs to be an equal effort to educate folks and to provide the resources that are going to help them, get off of these products. Dispelling the tobacco industry disinformation, that's one of the biggest things too, especially for folks in our position that they're gonna hear from the community folks. Well, this policy is taking away my freedoms. It's racist. So making sure that we're equipped to answer these questions. And when we talk about that, what big tobacco has done is made it, a racial justice or a social justice issue, and actually flipped it to make it seem like it's a negative thing. So menthol bans are going to increase police brutality, mass incarceration. Now, that's a valid concern from these communities that are already experiencing increased levels of police brutality, increased levels of mass incarceration. However, we do know, and the FDA has explicitly stated this, that this ban is strictly regulating manufacturers, distributors, retailers. It has nothing to do with individual use or individual possession of a menthol flavored cigarette. And the bigger picture here is, since there is no law enforcement involvement in the enforcement of this ban, if law enforcement is indeed using, this person's smoking a cigarette, this is going to give me an opportunity to engage this person. Investigative technique that they use to initiate confrontations or interactions. And I actually, if anyone was on the listening sessions and you heard the police force or some of the retired DEA agents that were making comments, that's one of the things that they actually admitted to doing, is creative policing, where they will initiate some random, non-required stop in hopes of digging up something else. So that's a systemic issue in and of itself, that if you take tobacco out of the picture, that still exists. It's been existing. So we can't blame tobacco on that. A flavor ban will lead to major black markets and illicit trade. Now that's another scare tactic. Now we have Canada, we have the state of Massachusetts, California is still getting theirs together. We have a bunch of hundreds of localities that have already instituted menthol flavored bans, not to mention some other countries in Europe. And this black market, this illicit trade has not manifested. We haven't seen the research to support this. And also we need to take a look at, well, you know, that language around it's going to lead to, you know, this illicit trade in Black communities. It's also peeling back enough layers. It kind of criminalizes the African-American community in a way of saying, you know, if Black folks can't get their product, oh, they're gonna break the law to do it. They're gonna create, the gangs are gonna take over, the cartels are gonna take over. And this is all coming from some of these listening sessions, and the ex-police department folks, the DEA folks are actually saying this. And again, there just hasn't been data to say that's going to happen based on Canada, based on Massachusetts, based on the European Union, based on Brazil. We haven't seen it. It's inequitable because so many Black people smoke. You're taking something away from Black folks. Well, you're taking something away that is actually going to improve the overall health of the community. So I'm not sure where that hurts folks. And the only reason it's there is because it was initially targeted predatorily to these communities. So taking it out of the communities is a positive thing. It's going to result in less initiation, more cessation, less exposure to secondhand smoke. So it's really not inequitable, because it's what it's doing is trying to even the equity field, because it should have been taken out in 2009 with the rest of the flavors. And here's a really divisive one. Menthol bans are going to put businesses, specifically minority-owned businesses, out of business, and take jobs away. Now, the truth behind that is that, you know, will some businesses maybe lose profit? Of course, that's quite possible. But in the overall scheme of things, you know, how much profit, how much margin, what's the margin for those menthol products? You know, if you really break it down, a lot of times it's not as much as folks believe it to be. But then the question also becomes, well, is that the type of product you want to depend your livelihood upon, knowing that it's killing, injuring most of its users and folks who don't even use it? So those folks that are being exposed to the secondhand smoke, third-hand smoke. And again, when we talk about the local level, the state level, what can be done, you know, if folks are going to be losing some of this income, you know, on the local level, what can be done to kind of replace that product with a healthy product? You know, get these small mom and pop shops connected so that they can accept EBT cards. They can sell fresh fruits and vegetables, or more of a selection of groceries, knowing that a lot of these stores are located in food deserts. So there's a lot of connection and a lot of opportunity and a lot of time, because it's going to be at least, you know, at least a year, probably more than that, before this actually comes to fruition. So there's a lot that folks can be doing, especially on the local level. Now, the public commenting period, it has been extended to August 4th. Correct me if I'm wrong. I believe it's August 4th. So an extra 30 days. Now, the question is, well, how do we submit a comment? What do we say? What do we do? Who can submit a comment? Anyone can submit a comment, whether you're an individual, an organization, a company, a store, a coalition, and we encourage all the above to submit a comment. There's a couple of different ways you can submit a comment. Here, I'm thinking as long as y'all see that, you can still click on these links, and if not, I can send the links in an email. On our page, on the Center for Black Health and Equity's page, we actually have a link where you can submit a comment to our page. And then in turn, we are submitting a huge comment, our comment, and then comments of support from other organizations and individuals that submit on our link. Now, the menthol comment and the flavored cigar comment are two separate documents. So if you want to submit a comment, you can either submit it to one or the other or to both. And our suggestion is to submit it to both. Now, the menthol comment will be in support of menthol being banned from all cigarettes, or from cigarettes as a characterizing flavor, flavored cigars from, the cigarillos, regular size cigars, exempting the premium. And this goes into some of the comments from earlier. Don't just say I support it, but say, and what will make it even stronger, what would make it even more comprehensive is if we did X, Y, Z. Now on our page, we also have a link to a template. So it breaks down a lot of the basics, but it's a Word document. It can be downloaded, you can be edited, put on your your company paper, your logo, to really just assist people in formulating how to make the comment, what exactly to say. And then that comment can be cut and pasted into the menthol comment or into the flavored cigar comment. And again, we suggest doing both. Actually, all three. Submit to our page, and then just cut and paste that into the menthol comment, cut and paste that into the flavored cigar comment. Of course, with the flavored cigar comment, just editing some of the language, and wherever it says menthol cigar or menthol cigarettes, say flavored cigars. And we can now go into the Q&A, but I do want to see if this will open up the link. And can folks actually see the FDA site right now?
No, we can't see it, but we did enter those links in the comment or in the chat box. I did link the Center for Black Health link for the proposed rule, and I see on the top right-hand side, you can submit it to the center. And then I also added the link for the template that you talked about as well.
Oh, awesome. Thank you. Thank you.
No problem.
And again, so we have until August 4th to get those comments in. So I definitely encourage folks to, if you need a template, there's that template on our page, and to submit the menthol comment and the flavored cigar comments. So let's jump into the Q&A. I think a few of those questions you sent were answered, but let's jump onto the ones that weren't necessarily addressed within the presentation.
Perfect. And just to clarify, I did look, and the comment period extended until August 2nd.
August 2nd.
That's the last day, August 2nd. Yeah, so a little bit before the 4th, August 2nd. No problem. I'll start off with some questions from registration first. So one that wasn't covered was, what are your thoughts about the popularity of synthetic nicotine incorporated into vaping devices as it impacts color of youth?
Oh, that's a really good question, because that whole synthetic nicotine piece, as of March of this year, so just a couple of months ago, synthetic nicotine now is regulated the same way as regular nicotine products. So it's being regulated like cigarettes, like flavored cigars. So it still has to go through, everything that this FDA the FDA rules are touching on. Anything with synthetic nicotine is going to have to follow those same rules and regulations. So if menthol cigarettes end up being banned, if menthol e-cigarettes end up being banned, because right now e-cigarettes aren't part of it, synthetic menthol e-cigarettes would need to follow suit. Now they are doing combustibles with synthetic nicotine as well, and calling it tobacco free. But like I said, anything that has synthetic nicotine is now treated as a tobacco product. And then as far as it impacts, minority communities, in the early stages, minority communities weren't using the e-products as much, but we're seeing a definite increase now. And we don't want to see big tobacco saying, hey, you can't get menthol combustibles, but you can still get menthol e-cigarettes, you know, so we definitely want to, again, push menthol being included completely, all products, all flavors, you know, synthetic nicotine, natural nicotine, it all ends up doing the same thing. It impacts how strong the addiction to the nicotine is. So there is a connection between nicotine and the level of menthol. And that's part of the reason big tobacco doesn't want to get rid of it altogether, because they know that with menthol, there is a stronger addiction to the nicotine. So that's something to really take home and realize that, you know, there's more to nicotine than just the flavor. There's the chemical components of it make the addiction to nicotine stronger and harder to break.
That's a great explanation. I didn't think about that connection, but that makes a lot of sense. And then going off of menthol, I know you talked about how, you know, when this rule is finalized, the FDA needs to clarify and define what is, you know, how much nicotine is rules a product as characterizing flavor. So in your opinion, I feel like you kind of answered this already, but do you think all menthol should be banned or only menthol as a characterizing flavor?
All menthol, you know, we just remove it completely. If we want to improve the public's health, the FDA has already said removal of menthol will improve the public's health. Not removal of menthol as a characterizing flavor, but removing it altogether.
Altogether, that's great. Hopefully they'll define that, because I know that's kind of a question a lot of people ask during the listening sessions. I know Public Health Law Center had some, and that's something where people asked. And then still going on with menthol, do you have any tips for people with family or friends who use menthol products, you know, when they hear about the ban or when menthol cigarettes come up in conversation, you know, what do you have like a template conversation or just tips for people to kind of bring up as well?
Yeah, well, one of the things that I would suggest is to kind of push the idea of, because most people want to quit, okay?
Yeah.
So just, you know, kind of implanting that idea with, hey, if you can't smoke menthol cigarettes anymore, now's the perfect time to quit. You know, this would be the perfect opportunity for you to, you know, finally make that decision. So kind of, you know, encouraging, you know, don't switch, don't go to e-products. This is the perfect time to quit. And then just being able to really explain, you know, how menthol is really impacting their tobacco use and how it's impacting their addictiveness and why it may be so difficult for them to quit. And then letting folks know that, you know, and none of this is on accident. Big Tobacco researched all of this. They designed the levels of menthol. They manipulated the levels of menthol to make it, you know, more addictive, to make the nicotine more addictive. And I saw in the Q&A, I'm just going to go ahead and address that question, like the psychoactive response between the nicotine and the menthol. Now that's a little out of my wheelhouse professionally, but the research, the data, the peer-reviewed journals all conclude that there is a chemical process between menthol, between nicotine, that makes it more addictive. And if you're melanated, if you're, you know, Black folks, brown folks, anyone with melanin, the more melanin you have, there's more tobacco or nicotine receptors in the you're involved with the melanin. So there's a lot of science behind it that Big Tobacco has taken advantage of. So again, when we see Black folks being less able to be successful in their cessation attempts, you know, it's because of menthol, how menthol interacts with the nicotine, how that interacts with your melanin and the tobacco receptors. So there's a whole bevy of science and research behind that. And it's that talk of addiction, I don't think is had enough when it comes to tobacco and quitting tobacco. It's like, oh, just quit. It's a habit, it's a bad habit. It's an addiction. So treating it as such is important as well.
Yeah, I definitely agree. I think being encouraging is probably the most important thing. But I think also, people, like you said, most people want to quit and they've probably tried to in the past, but they couldn't. So I think also educating them on what you said about how Big Tobacco has done their research and they target people in a certain way. They know how to, but also, letting them know the different ways to quit. And even if the first time, that doesn't help, try something else. So I think just letting them know that you're on their side and you're there to help them and there's different resources is encouraging as well. And just telling them, don't give up. It takes so many tries and it's different for each person. So even if you know someone who quit on like cold turkey, that may not always work for everyone else. So that's
sometimes you got to do instead of cold turkey, you got to do warm chicken. And do it slowly.
That's true. All right, what else? I know someone asked about the comments. So I know I linked those as well, and I linked the center's links as well. And I know the Public Health Law Center had webinars about the comments, the pros rules. So I think we linked them in the chat as well. What else talked about this? I know someone asked what we can do on a local level, and you talked about increasing cessation efforts, and I linked our Quit Now website as well, but there's a ton of different resources that people have access to. We talked about the deadline is August 2nd now, so not July 5th, August 2nd. And we have another one back on menthols. Why are menthols like Newports still so expensive compared to others and posing a continued equity issue?
And that's a good question. It was actually surprising because typically, in the past, what we saw was that menthols, specifically in minority communities and low-income communities, they were being sold a little bit cheaper. There was more, more sales and more promotions connected to menthol cigarettes. So just today, I was like, let me look and check that out. And I was in a Walmart this morning, and I said, let me looking at the prices, and sure enough, to my surprise, packs of menthols were, not dramatically higher, but like 20-30 cents higher, which is something I had not seen in the past. So that's an interesting question that I don't have an answer for directly, but in just trying to guess, it's okay now that we know, menthol is maybe taken off the shelves. There's this big talk, and people might want to start stocking up. We got to make this product cheaper so folks can start stocking up. We got to make it, now it's more expensive. I don't know. Again, it's very interesting to see that it's gone up a bit, and maybe what I just said is correct because they know folks are going to start stocking up. So let's just bump the price up just a little bit and have a little more in our reserves because we know there's the possibility that we're not going to be able to sell menthol cigarettes this time next year. But the pricing thing has always been one of the issues that made it more attractive to other communities because it was just a little bit less expensive. There's more promotions, more advertising. I mean, we're still seeing that in Black communities, minority communities, lower income communities.
Definitely. And then we had one question in the Q&A from Avis earlier. She was wondering if there's any information about when the menthol ban goes through, have you heard about people turning more to weed? I don't know if there's a connection or if you've heard about that, but she's kind of heard that a few times.
I haven't heard it. There's discussions and some of the discussion is, well, you know, they're making weed legal, but now they're going to take away menthol. That doesn't make any sense. So there's a lot more to consider in that. But as far as people going from menthol to marijuana, I think all of this deserves a second look, a harder look, an examination. But keeping in mind that, you know, marijuana is not legal everywhere, keeping in mind that even folks that smoke, that doesn't impact their job a lot of times. So I'm not gonna, if I know that, you know, I work in construction, or I'm a doctor, I'm a nurse, and that a mistake that's made, I have to take a drug test. You know, if I continue smoking cigarettes, they're not going to fire me because my nicotine levels were high, my cotton levels were high. But if I make an error and I've switched from menthol to marijuana, now there's implications to my livelihood. There's legal implications. So I don't think that is a huge concern in the public health realm. I think it is a concern just in general for legalization, and, you know, how that may impact, again, when we see when e-cigarettes first came out, folks that would never have touched a tobacco product, oh, it's not a cigarette, this is really cool. So we saw a whole new generation become addicted to a tobacco product who in the past wouldn't have done so. Could that happen with marijuana? Is that happening with marijuana? Probably. Now that, you know, if I know it's legal in my state, in my city, and I can actually get it and try it, and, you know, I'm not going to be breaking any laws, that could be happening. So it is something to be aware of, but connecting it to menthol and then higher use of marijuana, I haven't seen anything that projects that. Not that it's not out there. And again, but I would say, and when we see things like that, to really peel the layers back and look at where it's coming from. Is it peer reviewed? Is there other supporting information and data behind it? And then, you know, even on the local level, you know, when we're doing our surveys, throw that question in there, see what's happening on the local level.
A good answer, thank you. And then I think we have time for one more question. I just wanted to address, earlier talked about melanin and nicotine, and Bonnie asked that she's never heard about that. And I believe from webinars and talks I've been to, I believe it's the more melanin you have, the more nicotine is stored, something like that. I don't know exactly, but I tried to Google something, and I know Dr. Philip Gardner had a presentation about that, and I've heard someone else talk about it as well. Do you have any resources that on top of your head, Michael? Just really quickly before we close up.
Not on top of my head, but I will find those articles and send those links.
Perfect, perfect. Well, I think that's all the questions we have so far from the registration, and also today. I know we have some more comments, but thank you so much. I'm going to pass this back to Gina to kind of wrap up everything. Thank you, everyone.
Thank you.
Great. Thank you, Nicole.
I'm going to put a link in the chat just for a quick survey for the participants. Panelists, feel free to answer as well, but definitely for the folks attending. And there it goes to everybody.
Great, thank you, Michael. I had a quick question, just out of curiosity. Why do you think they extended the comment period?
Because of requests. So there was a lot of requests from public health folks, but there was also a lot of requests from just the public in general to have more time. Because I think, you know, if you're not in public health, if you're not directly adjacent to the big tobacco industry, to menthol, the public health, what's the public comment? So, and I think that says a lot to us about, you know, us folks in public health, getting the message out to the public and saying, hey, you have a role in this. Your word, your opinion matters. And then folks wanting to be prepared to make that proper statement. which is kind of why we put that template out there to help folks, guide their comment. But that's what it was. It was folks asking, hey, we need more time. We need more time.
That's great to hear, because I was thinking maybe the tobacco industry had something to do with the extension, but it's great to hear that it's public health and needing more time to make comments. Yes.
In the same vein, now that's going to give them more time to pay their folks who are submitting their thousands and thousands of comments. But I think the FDA is wary enough to know that a lot of the comments that are coming in support of big tobacco are just that, paid comments, folks that are they had some level of interest in keeping menthol on the market. But the more comments that we can get from individuals, from organizations, whoever, the better. So I'm all for the extension.
Wonderful, wonderful. Thank you, Michael. This was great information today, and I know everyone really appreciates you being here and sharing that with us. And for those on the call, we did have some difficulty getting on the call this morning. So if you know one and can share with anyone, that the recording will definitely be sent out to everyone, and encourage them to watch it and learn more about the comment period and how we can be kind of vigilant as this comment period goes forth to really make sure that FDA knows that what we believe and what public health needs. And I think one of Michael's comments that really kind of struck me is that this ban on menthol, the ban of menthol in its entirety, will make an impact to all public health, so everyone. And I think that's the reason we really need to be very vigilant and work with all of our public health organizations, work with the center, and make sure that we make a comment and make sure that menthol is banned, because it impacts so many people out there. So thank you, Michael, again. Your presentation will be shared. I encourage everyone to share it with their friends and colleagues also.
Thank you. And I do see a couple of folks have put those articles on the relationship between menthol and nicotine in the chat. So thank you for that.
Wonderful. Our next webinar will be Tuesday, July the 29th from 10 until 11. We will have Rebecca Padillo. She's a national manager for the tobacco programs with the American Lung Association, and she will be talking about asthma and athletes and vaping and how that all correlates and relates together. So please share when you get the invitation out. Thank you so much for joining us today. Enjoy the first day of summer and your entire summer, and just have a ball eating whatever ice cream you chose as your favorite ice cream. Enjoy your day. Bye.
Thank you.